folks. My name is Mo Amir, and this is VANCOLOUR, British Columbia's bona fide culture and politics TV talk show right here on Check and Check Plus. We're also on Apple Podcasts, Spotify, and YouTube. Tonight, let's talk about how 15% of Canadians, including nearly 1 million British Columbians, don't have a family doctor. And even folks who have one may have to wait weeks to actually see theirs. According to BC Health Minister Adrian Dix, the rate of British Columbians without a family doctor increased 70% from 2003 to 2017. As the COVID-19 pandemic has amplified the gaps in our province and country's healthcare system, some BC communities have even temporarily lost access to emergency room services. BC also has some of the worst wait times in Canada when it comes to walk-in clinics, up to 4 times the national average, with Victoria recording an average wait time of 161 minutes. And yet, Canada has a higher than ever ratio of doctors to the population, graduating more doctors than ever before. So what's going on? Our first guest tonight will help us shed some light. A researcher and assistant professor in family medicine at the University of British Columbia. She is a family physician in East Vancouver. She is Dr. Rita McCracken. Dr. McCracken, so nice to see you.
Thank you for having me.
My pleasure. So what's going on here? Why is there a shortage of family doctors in British Columbia? How do we get here?
Right. Well, what we've got is not necessarily a shortage of family doctors, but we've got a problem with access to primary care.
Okay.
So we've got enough doctors, but we don't have enough of them providing community-based longitudinal primary care. Instead, they're doing other really important work in the community and in hospitals. So for example, providing focused care for folks with addictions, sports medicine. They're staffing our emergency rooms. They're providing long-term hospital care, residential care. They're choosing to do that because that job environment is much more attractive than the job environment that we currently have for community-based longitudinal care.
Right. So is it that it's just not attractive to do family medicine, or it's just not profitable, I guess, to do family medicine?
Yeah, you know, most people in medical school don't choose family medicine to get rich. It's not the specialty for that. It has... The majority of community-based primary care is run as a business. So the physician is the business owner. They are paid directly from the government for the services that they provide, and then they need to use that money that they get to then have a lease for a building, be able to hire their own staff, get their own IT, and make arrangements for their own parental leaves, for their vacations. And what we're seeing is that the pandemic was just kind of the straw that broke that camel's back.
Right.
There's some people who, they're really built for that kind of practice, which is great. Thank goodness we've had them because they've been providing excellent care, and they're the backbone of our current primary care system. But if we want to address this problem of not getting enough people providing primary care, we need to fix the job environment, and we need to provide an infrastructure so that people want to work there and can be well supported to work there.
So from my understanding, this is a structural problem across Canada, but is British Columbia particularly worse or maybe even better in some regards when it comes to family medicine and primary care?
Well, British Columbia is a beautiful place to live, and so that's an amazing thing.
I feel like there's a but.
However, the vast majority, greater than 70%, probably closer to 85% of our primary care is delivered using an older system, the fee-for-service, again, physician-owned business model of primary care. In other places in Canada, for example, Ontario, and Manitoba and Nova Scotia, we see more of a clinic infrastructure. So if I can give you an analogy.
Please.
Imagine if we had a shortage of spots for kids to get elementary school education. And we went, aha, what we need to do is we'll graduate more teachers, or we'll hire more teachers from Alberta, and then we'll say to them, please set up your own school, and we'll pay you per student, per lesson. And you can see immediately that that's not going to help. Those teachers need a school to work in,
right,
and they need a team to support them for all the other needs that the kids are going to have.
Right. Now, I'm hearing a lot of talk about, let's just bring in nurse practitioners to help with access to basic primary care. Is that a solution that can work, or at least provide a stopgap to some of the issues that we're seeing?
I think nurse practitioners are an incredible member of the primary care team and can probably offer primary care access to people who would be able to be attached to them. However, we don't have that many nurse practitioners. And in order to scale up the number of nurse practitioners, that is a many years project. And as well, family medicine and primary care, it is really the heart and soul of a family doctor's job. Mm-hmm. And we are training most of our family doctors to do this community-based primary care. They want to do it. Right. Some of the research that I've been involved with shows that almost all of them who are graduating want to do this work, but they can't find an environment that is going to allow them to also be a parent, to get sick if they look after elderly parents. They just are not prepared to take on that huge burden of also running the business.
Right. So short of like artificial intelligence and robots that can do all of this work, what can actually be done? What can be done? Because obviously this is a big issue. Increasingly more British Columbians don't have a family doctor. Yeah. They don't have access to this primary care. So what can we start doing?
Well, first of all, in the short term, we need to look to the people who are providing primary care right now and make sure they have all the resources they need. That might mean a bit more money for them, but it is probably also going to be real resources so that they can focus on the medicine. They don't need to do the administrative work. They don't need to run the business if they don't want to. So making those resources available as soon as possible so that we can preserve the people who are providing this care so they don't want to leave. That's important. And then we need to look long term. How do we create that level of infrastructure like we have for the public school system? If publicly funded primary care is the cornerstone of our healthcare system in Canada, we need to have that infrastructure. We can't continue to expect individuals to altruistically create a parallel infrastructure.
Right. Now, obviously, in the political sphere, this is causing huge debate. We saw Premier John Horgan drop an F-bomb over this. There's a lot of passionate voices. But is there anything that's happening on a policy level that's maybe giving you hope that the government is moving in the right direction?
Yeah, I think so. I've heard the Premier and the Minister of Health acknowledge that this is very difficult, acknowledge the frustrations of the physicians. I've also heard them talk for at least the last 3 years about the importance of team-based care and the importance of creating that infrastructure. I think where the rubber hits the road, we're hitting a few issues about how do we actually make that happen. But yeah, I am feeling positive that understanding what the problem is nobody's saying, okay, we just need to hire another 357 more family doctors to solve the problem anymore.
Right.
We used to be creating those kinds of calculations, and now we're talking about what the system change needs to happen. And it's just everybody right now is so frazzled. They're exhausted. The pandemic is still going on. And so we just need to figure out how we're going to come together, make some short-term solutions, monitor them to see if they're working, and also have those medium to longer-term goals of system transformation.
Absolutely. So let's talk about some of those frazzled people, some of those frazzled British Columbians who are lacking this access. What would your message be to them in terms of trying to navigate through this political debate, trying to navigate through understanding of how the system works? What should they be looking at, and what sort of solutions should they be supporting when, politicians use this as an election issue?
Right. Well, number one, if you're affected by this, you should let your MLA know. And many of your listeners and watchers have probably already done that. But if you haven't, you should, because I think those stories are the thing that really allow us to prioritize what needs to happen. And I think our members of Legislative Assembly need to hear some more of those stories. As well, I think really looking for longer term solutions. So I've heard Many people in my own family will say, well, why don't we just get more doctors? Why don't we just make it easier for IMGs, international medical graduates, to practice in Canada? And well, I think that we absolutely should be reviewing the process that we're using for international medical graduates. Just adding more doctors to the soup that we're in right now is unlikely to change things. So looking for real infrastructure investment, do we see what's happening in primary care changing to look more like the public school system? And if so, I think that's the direction that you should be supporting when it comes time to vote.
Absolutely. Well, I appreciate your advice. I appreciate you explaining this very complicated topic that is affecting a lot of British Columbians. Thank you so much for your time today.
It's my pleasure. Thank you.
Folks, that was Dr. Rita McCracken, assistant professor in family medicine at the University of British Columbia and a family physician in East Vancouver. Now, after some business, what is populism? Who is a populist? Am I a populist? I've been accused of being one, although, to be honest, I'm not exactly sure what it really means. So let's find out together. Political theorist, commentator, Washington Post columnist, and fellow podcaster David Moscrop is up next. I'm Mo Amir. This is VANCOLOUR.